Hi, this is Alex, and the topic that I want to discuss this week is motivational interviewing with addiction. I know that we kind of touched on this subject sometimes during each week this semester, but I wanted to go a little bit deeper into this specific topic. Um, the background on the reason I chose this topic is it's actually more of a personal reason. I do have some family members who have suffered from addiction in the past, and because motivational interviewing is so good at promoting behavior change, I wanted to see if there was any evidence that motivational interviewing was effective in the area of addiction. So I was able to research and find a few studies to gather some of that information. So the first study I looked at the effects of addiction in a variety of treatment programs. They broke it down into three programs that they put the participants in. The participants were either separated into a motivational interviewing group, an individual intervention group, or an addiction program of probation group. And all of these participants had had some sort of substance abuse that had landed them on a probation period, and had to be part of a treatment program as well. So at the beginning of the study, there were 30 people that started the study. 10 were separated into, or excuse me, there were 30 participants per group that were separated into one of the three groups. For the motivational interviewing group, there were three groups of 10 that would meet once a week for about 45 minutes each week. And then with the individual intervention, they each had individual sessions with a psychiatrist. One psychiatrist was over all 30 participants, and they met every single week. And then for the addiction program, there were 28 participants, and they were also assigned into three groups of 10 and met for about once a week. And the therapist that led the addiction program also led the motivational interviewing program. So I think that one of the limitations of this study would be that maybe some of those motivational interviewing techniques carried over into the addiction program, so maybe the results were a little bit construed because of that. Each group had to go through pre-assessment forms. They filled out questionnaires and everything, and then they also filled out questionnaires to assess their behavior change throughout the study. The most common substances that were used with these participants were marijuana, alcohol, and cigarettes. And over here on this side, it's not very visible, but this kind of breaks down what the motivational interviewing group sessions look like weekly and what the addiction program sessions look like weekly. So as you go through the motivational interviewing, you can kind of see some of the techniques that we have gone over this semester. And the results of this study kind of showed that overall, all three groups had a significant increase in the readiness to quit their substances. And in the motivational interviewing group, there was a decrease in the severity and the frequency of substance cravings in the participants. And also with the individual intervention group, it also had a significance in a decrease in severity, frequency, and the duration of the cravings. For the motivational interviewing group, there was an increase in the importance of quitting their substance and knowing that they needed to, so the pros and cons were assessed by each individual in their group setting. Some of the strengths I found with this study were they studied the effectiveness of multiple treatment options and were able to compare the three and the results. And this study had a very low dropout rate. It was less than 5, I believe, that actually dropped out of the study. The biggest limitation with this study is it was not a randomized or double-blind controlled trial, which means, like I mentioned, with the therapist being in both groups, that some bias and possible treatment overlap may have occurred, which could have construed some of the results. So the second study I looked at was for teens who were suffering from substance abuse, and kind of looking at how motivational interviewing and the acceptance and commitment therapy model could be used. So 41 participants were in this study, and their ages varied between 12 and 26. They wanted to use young adults as well because substance abuse is so high in college students. So they decided to have a very large age group when it came to young people. Before the study, participants were to complete an outcome rating scale, which basically measured their emotional wellness and quality of life before the study, and they also filled this out throughout the study. The time follow back interview measured the number of days substances were used and how frequent they were used. And then the session rating scale was used throughout the study, so participants could provide feedback on the sessions, and then therapists could look at it and see what to work on. The study lasted about 12 weeks and included 60-minute individual sessions. They used both motivational interviewing and acceptance and commitment therapy. And if needed, sometimes family interventions were added to kind of help get the family involved. The results of the study showed that there was a positive correlation between the number of sessions attended and improved well-being scores. This number was not significant, but it was showing a positive correlation. There definitely was a significant difference between the pre-well-being score and the post-well-being score. So overall, the well-being and quality of life improved from the beginning to the end of the study. And then 71% of the participants reported being sober for at least a week or more during the program. And then the therapist recorded some of the comments that participants made, and the most common ones were that the participants with the motivational interviewing, they didn't feel judged. They felt motivated to quit smoking or quit using their substance, and they felt listened to and respected, which is something that goes hand in hand with motivational interviewing, is it's very patient-centered. Some of the strengths I found with this study was it can be applied in a clinical setting, as motivational interviewing can be. And it could be the spark of further study in this area because it did have some good results. Some of the limitations of the study were, once again, it was not a randomized controlled trial, so some bias may have taken place. And this was a relatively small sample size and not really representative of this age group overall in the United States. And then the final study that I looked at actually compared substance abuse with mental health. So looking at patients with schizophrenia that also use substance abuse or substances, because there is a high percentage of people with mental disorders that actually do participate in substance use. So this study was a 9-month study with 36 participants. What's different from this study, the other studies, is 36 participants were actually paired with 36 different caregivers. So they came together as a pair. Of the 36 participants, 19 reported using drugs and alcohol, 11 reported using only alcohol, and 6 reported only using drugs. Over the period of the study, the participants were exposed to 3 intervention programs, which consisted of motivational interviewing at the beginning of the study, followed by individual cognitive behavior therapy. This session here also included some motivational interviewing as well. And then finally, the last bit of the study was family sessions. Some of the assessment tools were used to assess the patient's severity of symptoms and frequency of their relapses, and what substances they used. It also assessed patients' ability to function, so they knew how they would react in therapy sessions and things like that. I think this study was the weakest study that I looked at because it did not have very many results that were significant. The most that it reported was that participants had an increase in percent of days sober over a year period, and some participants experienced a reduction in symptoms. Nothing was very significant, and it was very, very vague. The one strength I did notice about this study was it was a randomized control trial, but like I mentioned, the limitations of this study, the results weren't significant, and once again, we were dealing with a smaller sample size. So kind of based on what I looked at with these studies, my personal opinion is that motivational interviewing can be very beneficial in promoting behavior change in patients suffering from addiction, because once again, you are helping the patient determine their reasons for wanting to make the behavior change and what they can do to do that. With the study results, it has shown that motivational interviewing helps increase the time of sobriety, so longer periods without using the substances, which can improve the motivation to change. Patients are feeling like they are being listened to and that their concerns are being addressed, which increases motivation to change. There is a limited research in this area, which I think will fuel motivation to have more studies conducted in this area to see how effective that motivational interviewing can be in this area. And those are my references. If you have any questions, feel free to comment on my post in the discussion, and I will get back to you and answer them as best as I can. Thanks so much.